starting over after technical difficulties. So we're here with Alice Harvey. She's our public health director for Rio Blanco County, and she's got some questions that we've shared with her about coronavirus and COVID-19, and she's going to respond to those. Our first question that came in through our survey was about the use of ibuprofen, and people concerned about that making them more ill, causing problems. Alice, what are the current recommendations for ibuprofen and NSAIDs?
Sure, that's a good question. And thank you very much, Nikki and Caitlin, for having me on again tonight. Really appreciate it. So in terms of the ibuprofen, this warning came from some observations that were made by doctors in a team of doctors in France early on, who noticed that some of their patients were getting sicker faster with the use of NSAIDs. And NSAIDs, by the way, that does include, it's not just ibuprofen, so it's aspirin, naproxen, and some others. Doesn't include Tylenol in this, but what they found were that they were concerned because some of their patients were getting sicker. The WHO initially put out a statement that ibuprofen should not be used, but they have since retracted that statement due to a lack of evidence. And this whole thing is just so new. There's so much data we're collecting, and there's so much we don't know about the virus itself. So we would still like to say to not use ibuprofen unless if Tylenol is not working. So use Tylenol first, so acetaminophen. And just because there is that hypothetical risk still, they're still studying it. And it has to do with NSAIDs increase a certain kind of protein on the surface of our cells. So there was thinking that this particular protein might be involved in the binding of the COVID virus to our cells. And then it may have been causing the infection to act faster. So our recommendation while we're still waiting is to use acetaminophen first. Reach out to your healthcare provider before you use NSAIDs if your fever's not controlled with Tylenol, just to be safe, since the jury's still out on this one. And we are not the clinical experts by any means on this topic as well. So we definitely want to go with whatever our healthcare providers suggest. And, our advice never takes the place of your doctor's advice. So reaching out to them if Tylenol's not working, not doing the job to control your fever is probably the safest way to go until we have more evidence proving, the validity of this claim one way or the other.
Okay, and people should be paying attention because everything is changing so fast.
Exactly. Yes, definitely.
Around on a dime, it seems like. Okay, our second question that came in was from somebody that said they read about needing to take a shower and wash all their clothes after they go out to the store or to the post office, and wanted to know if that was good advice or if that's going to an extreme.
That's another really good question. So a couple of things here. This is extreme for the layperson. However, I'm going to go over a couple of things. Infectious disease experts are pretty much saying, in general, you don't need to shower or launder more frequently than you normally would, unless you're in high-risk situations. And that's the key here. So a shower every day can't hurt. If you're in contact with people for any reason, like in your job, then it definitely can't hurt to launder your clothes, be extra careful, and wash them after that contact. Now, healthcare workers or people caring for people who are sick, then yes, definitely. And we really emphasize that with anyone who has close contact in their job, because they're actually getting that, potentially have those respiratory droplets on their clothing and their skin, even though the virus is much less likely to live on clothing. The best research coming out of John Hopkins right now, that's the place that's doing a lot of research on how long the virus lives on different surfaces. So you've probably all heard by now, they're looking at about 72 hours, up to 72 hours on plastics. I think it's 48 hours on stainless steel, 24 hours on cardboard. There's no definitive studies on fabric. It's a little harder to study. They're saying probably a few hours, at most a day, but so we recommend definitely that caregivers and healthcare workers shower after shifts and not let their clothes contaminate their homes, take off their shoes, etc. That's pretty much the general rule for healthcare workers. But then it's similar to like with face masks. We're not going to say everybody needs an N95 respirator, but not because it's not more protective than a cloth mask, but because we're basing that based on exposure level and risk level. But I think that the biggest take home point, although the experts don't say it's necessary, there's a couple things to think about here. And this is why I say, hold on a second and let's think about it. So, cleaning and disinfecting the high touch surfaces and avoiding touching those when you're in public is your best bet. So there's no evidence that taking extreme measures of precaution will, are necessarily going to help you any more than if you really, really live by the hand hygiene and disinfecting of those contaminating high touch surfaces. Those are the rules. That's what's going to help you. But we also know that, we don't live in a perfect world. So your neighbor might not be adhering to the rules. You might have stopped at the grocery store, said hello to them. They might have sneezed or coughed on you. I always think about well, what if they touched the cereal box before me and then I came up and touched it? So there's just this, and I say this not to scare anyone, but really to say these fears are totally validated. So most importantly, experts are worried that the preoccupation with things like showering and laundering the clothes will take the place of the more important measures like washing your hands, maintaining the 6 feet between you and other people in the store. But so the recommendation is to take precautions based on your risk level. But on that note, it definitely can't hurt to wash your clothes after you've been in a public space. Definitely not re-wearing clothes after you've had any interactions during the day. So maybe not, every time you walk back in the house, you need to wash your set of clothes, but thinking about who you were exposed to, what level of contact you had. Mm-hmm. So I really like that part of the question that said, in terms of, when and where, really, that's what you should be thinking about. So if you you're in any situation, say you go to the post office, you run into somebody and you're in close contact with people, because we realize that's going to be unavoidable at times. Mm-hmm. So then the answer would be, yes, why not? Take a shower and wash your clothes. But as a general rule, it is extreme just knowing what we know about the virus so far, that is not the highest risk that's posed to you, getting it on the clothes in the grocery store. So okay. I hope that answers that question.
I think that does answer that question. There's probably going to be people that will shower and wash their clothes anyway. Mm-hmm. It's because.
Right, exactly. Oh, and one last thing on that, Nikki, I was just going to say, important, because I do get questions about this. Regular detergent works. So the virus has a lipid layer. It's like a fatty outer layer. So just using plain, that's why washing your hands with soap and water works. So regular washing detergent is fine. And the hottest water you can use is better. So when you work as a nurse in a hospital, you kind of come home, shed your clothes before you go in the house. So maybe not to that extreme, but I think taking your shoes off when you walk in the door, going straight to your room, taking your clothes off, having it in a laundry basket, and just being conscious of those types of things. And then not sharing shower items, those are some other things you can do to reduce the risk a little bit.
Okay. Just a different way of thinking about things than most of us have applied for a long time. Okay, third question, and the third question and the fourth question are going to kind of go together. The third question is about antibody testing. Okay. Can a person be tested to find out if they have the antibodies for COVID-19 if they think they've been previously infected? That's question 3.
Okay, so the answer to that is not yet. It is not currently available. However, this is the kind of thing I'd like to want to go into in my weekly updates, but it's just there's far too many details. So this is a good opportunity. So currently there have been antibody tests that have been developed. They've been given an emergency authorization to be used by the FDA has given an emergency authorization for them to start being used by some commercial laboratories. So those things are starting to happen. There's a task force that will be presenting, a Colorado task force that will be presenting. They're doing a big assessment right now on the findings of all these new tests and commercial products that we should have by the end of the month. The governor promised that before the public health order, stay-at-home order was lifted, so that we can really start to make a roadmap for testing in the future. At public health, we've pre-ordered some of these. I know the hospitals will be working on this also. So the answer really is not right now, but as far as, to where and how, there's not one yet, but we'll be passing that information along as soon as we have it. The reason why the answers to testing questions are never simple is because it's really not simple. It's crazy. It's probably the one thing that drives me the most nuts in my daily life. The testing landscape is changing constantly. So, as you know, this is a national issue in terms of lack of resources and supplies. And so we're fighting every day here to bring as much testing capacity as we can as possible to our county. So we'll continue to be completely transparent about that. And clearly our priority has been, and it'll continue to be supporting those who are really ill, or have underlying conditions, the most vulnerable. like frontline workers and people who live in nursing homes, et cetera. So we've been really lucky here in that we've been able to do that testing for those high risk groups this whole time because of our two incredible hospitals. So that's fantastic. We've been able to facilitate testing on some level. There are some places in Colorado where they don't have critical access hospitals. And I will be completely honest in telling you, we have gotten 0 test kits from the state at the however, we started planning early on for the worst. So we've got orders with various private vendors. So there's a whole lot going on. We do expect to be able to fill in the gaps with testing eventually, including antibody testing and what that will look like and who will be, what scale it'll be on and who will be testing. Of course, those are all questions that I don't have the answers for yet. But I can definitely tell you that, we've been very lucky to have the testing availability here for those who've needed it the most thus far. But we're constantly working on ways we can expand that in the near future. So that's really the best answer I can give you.
Possibly by next month when we do this again, we'll have more answers to that.
Yeah, definitely by next month, I would think.
Okay.
Next couple of weeks, we should be getting that task force report that'll really kind of say, okay, here's what antibody testing is available, here's what we're recommending, and here's how it'll kind of roll out. And I always joke around, it truly is like in the movies when, I've gone back and watched like Contagion. I watched that the other night and just had like, this just crazy how realistic it is now. But, when you see everybody scrambling, scientists scrambling to make the vaccine and make the testing, that's all really happening.
Yeah.
And so I've been trying to keep on top of that while at the same time fight with people for test kits and just really try to, balance it out. And we've been working, again, we're just so lucky to have our hospitals because it wasn't for them, we would have been in a much worse place as far as testing is concerned. So we're very grateful for that.
So that question rolls into the next question. I know you've had this conversation with people. I've had this conversation with people. There was a wave of respiratory ailments that came through our county back in December, January, that weren't flu. People were tested for influenza. Their test came back negative, but they look back and they're saying, all of my symptoms fit. I think we already had it. What's the likelihood of that? Or is there any evidence for that?
And that's probably the $1 million question. And I actually love being given the opportunity to answer this question. Because there's so much that goes into it. In fact, it's hard for me to even formulate an answer that is short and succinct because there is so much to talk about here. The answer is the likelihood is low, and there's 2 reasons for that. And I'm going to talk about 2 different things here. Number 1 is based on just the virology studies that are being done on the mutation of the virus itself. And I would like to show a website I'll share my screen after I talk about it a little bit. To explain that. And then the second part is based on analysis that we've done on the clinical presentations in the community. So looking back to January as well as we can. So the first part, and a lot of people probably have Googled and seen a lot of these things, but I will share a really great website with you. Virologists have been tracking the viral mutations of this virus. And what they do is they study the genetic material. So they're at the point where they can actually map those mutations. And that's what they've been doing. The more samples they have, the more they can study. They actually have a pretty good handle on the timeline for the history of when and where it started and how it traveled over the past few months. Now, there's a ton we still don't know. Okay, tons. So definitely don't take this as, that we know everything because anything's possible. But do we think it was here in December? The answer is definitively no on that one. For as early as December, they haven't figured out all the bits and pieces, like which intermediary species. You've probably seen the pictures in the news. They're trying to figure out what went from bat to what animal, et cetera, et cetera. But in terms of geographically, they have been able to map this. So there's this big database called NextStrain, where geneticists are continually analyzing the growing collection of these viral samples. So they can update the family tree of the virus, and I'll show you that in just a second. So they determined pretty confidently it was not spreading in December in the US. And again, this is based on like the RNA sequencing of the genome, and it's way, way too smart for me to really explain it well, but I'll show you this website that makes it kind of visually easy to see. But it's likely that it was introduced in January in some places in the US. And, of course, due to our capabilities to do comprehensive testing right early on, it's very likely that some of those earliest cases in New York and Washington, for example, were missed. And we're probably talking more like February at that point. So in Meeker and Rangeley in January and February, highly, highly unlikely. The second reason for that is the clinical picture. And so Kelly and I have actually, we've been at public health. You've heard me, Nikki, talking about it, rambling on about this health database at my updates I do monthly for the commissioners. And we were actually pretty close to launching this new health database, and this was the very purpose for it. So we're still planning to do that. Hopefully within the next year, we'll be able to get this database launched, where for the first time ever, and we'd actually be one of the first counties in Colorado to do it as well, which is really exciting because we're so small. But it would basically draw on data from both our hospitals so that we could do things like this, where we can track trends. Like, okay, for example, it's flu season. Let's see how many flu-like illnesses we have during flu season. Is it normal for this time of year? Or if it's not, what symptoms are we seeing in people? And the very purpose of this is so we can do this very thing, and that's to kind of figure out what's going on with various viruses in our community any given year. So of course, we didn't have the ability to do anything at that level because that database isn't developed yet. But we didn't see a distinct increase in the number of sick people that met that COVID profile. So even if it was higher than normal, for this time of year, which at this point we can't say because we didn't have that data tracked on that level, we have never had, we didn't see anything that was mimicking COVID, typically higher at the rates where it would have been, indicated that it was spreading in our community. And our high population of people with underlying medical conditions also, we would have expected to see more seriously ill people, which we did not. So we're so thankful and grateful for that. And in some ways, obviously, it's like no news is good news. So in this case, it's like no data means no, we're not quite sure. However, we can definitely say that, anyone who is in the hospital and ill with those symptoms, who are sick, and needing hospitalization, qualified for a test. And so we've done, I think, 85 at this point. One has been positive, a few pending. So if we've got, 82 negative tests, then clearly there's other things going around. And we've noticed on our self-screener tool, and I'll share that too in just a second, that, even with the responses we've had there, we only had 4 people who had the fever. And, we know that based on the data we're collecting nationwide or globally from people who have tested positive, that's the number one shared common symptom. So there's definitely something that was going around that was making people pretty sick and presented as a pretty bad cough. Mm-hmm. We did notice, actually, we had a cluster investigation in November of another thing, which was definitely not COVID, but something that had occurred. It seemed to be attacking younger people. It looked like a type of pneumonia. We never had a definitive diagnosis, but we studied it a little bit just to see kind of what was happening with it, because we noticed there was an uptick. Everyone recovered. And again, it kind of inspired us to continue pursuing this database so that in the future we could look back and go, no, actually we had the exact same number of sick people this year as we did in years past.
Okay.
So that's the long answer to that. We haven't seen anything that would indicate it. One last thing, because I get a lot of questions about the sensitivity of the test. So clearly the sensitivity of the test is not perfect. The numbers as the data is coming in, we're looking at anywhere between 60 and 75% sensitivity, meaning it's very possible to have false negatives. Mm-hmm. However, based on the fact that we've had all the negatives we've had, you would still expect to see some of those to be positive. Obviously, they're not all false negatives. And those people were sick with something. So this is where when we talk about confirmed cases versus presumptive cases and all of those words you hear thrown out there, that's why it's as clear as mud, because it really is. But I hope that answers that question.
Yeah,
as to what we're thinking.
I think that. Do you want to share those screens?
Oh yeah. Let me do that real quick. Thanks for reminding me that I was going to do that. So this first website is just fun to look at. Again, it's way above my pay grade. But it shows you, let me just go back, actually. This is called NextStrain. So this is that global database that all these scientists are putting their information in. And if you look, it updates this pretty frequently. So as they study the genome this is where, they're mapping. Okay, here's where it was, here's the location, here's what the mutations look like. So that's how they can kind of track and see. And this is, again, as you can kind of see back here, we're looking at, back in December, they've got almost 100% confidence that it was originated in China at this point. So then you can see where they've detected it going across the world. So this is one thing to kind of check out that explains that a little better. And then I will show you the self-screening tool really quickly. This is our new website. We do have a lot more data on there now. If you haven't checked it out in a while, we're showing more kind of how we're tracking suspect cases. Most of these, again, people who have been tested have been negative. We don't necessarily think these are COVID patients or, suspected COVID cases. However, we have to take it. We have to act like any of these could be. So that's why we're tracking it. But this is what the self-reporting form looks like. And so you just go on and you fill this out. It really doesn't take long. And then you submit that. It is entirely anonymous. And you can actually put, the date of when this started. So even if it was back in January or February and you had something that you thought might have been similar to COVID, you can go in and fill this. And then that'll allow us to look back and say, let's look at what these people are saying and make some presumptions there from that data.
Okay, thank you. That's very helpful. Then the next question that we had, we're starting to hear people saying, when can we get out of lockdown? When can we get out of quarantine? When can we stop doing all of these things that we're doing? Wouldn't it just be better to let everybody out and establish herd immunity and just keep the elderly people locked up? So what's the drawback there?
Sure. There's lots of drawbacks to that. However, I will definitely say that I know at this point, everybody is definitely like, oh boy, how long can this go on? Life must go on, right? And I understand that completely. And we'll continue on my weekly updates to share kind of what we're hearing as far as how long these things are going to last. So I won't go into that right now. To answer the question specifically, the answer is absolutely not. Unfortunately, people don't, it's just hard to understand what herd immunity actually means. So the best way I can describe it, of course, it's hard to predict anything in a pandemic, especially when this situation is changing every day, literally changing every day. But one thing we do know for sure is that this thing spreads fast. In reality, we normally achieve herd immunity with the aid of vaccines. So with no vaccine presently available, if you crunch the numbers, that means that 70% of the entire population would have to be infected to truly achieve herd immunity. There's absolutely no way we would keep that from spreading to older adults by keeping them locked up. That's impossible. And those who had underlying conditions. And so if you look at the fatality rate, even though it's potentially less than 1%, if you had 70% of an entire population and you take 1% of that, it's obviously that 1% of all of the 70% of the people in the country could die. It's clearly that's a catastrophic outcome. It's just, and if you're 70 or older, it's closer to 8% fatality rate. Mm-hmm. So you really just have to ask yourself, clearly there's other realistic practical points, like with 10% of all of our infections needing to be hospitalized, there's no way our health system could handle that amount of people, and again, all at once too. So unfortunately, herd immunity, it just isn't a solution, but eventually, and this is where I like to kind of explain to people, that will happen. That'll only be when we have a vaccine developed and not a second earlier. But at that point, we really will be able to stop it. Eventually life will get reintegrated and that normal activity will get reintegrated. We'll be able to generally get back to normal. But the idea of not doing the lockdown and just letting everybody get out there, get sick so they can get immune is just entirely impractical. And another way to explain that would be like with the flu. So if we did not have a vaccine for the flu, we would have lots and lots of kids dying every single year. We already do have a lot of kids die every year from the flu. So I don't even want to think about going back into a world, which I know no one would either, of what it used to be like when we lost lots and lots of people to communicable diseases. Right. Before we had herd immunity, in a large part, we can contribute to the use of vaccines. And so I think it's important to understand that realistically, how you get the best outcomes is by having this temporary lockdown. It's awful. but it's, again, it won't last forever, and it allows us to manage it and lessen that huge impact on our communities.
So we've had a couple of questions come in from people on Facebook. Anything on when non-essential businesses will open? That's not coming from your department necessarily. That's coming from the state.
Yeah. Yeah.
And how long do you think we will need to continue practicing social distancing? And these other measures, is that just going to be a long-term?
That part will be longer than the orders. So the best way that we can, and this again, definitely don't have a crystal ball, but from what we can tell, we've done a decent enough job with social distancing in the state. We're hopeful. The governor's stating that, so far we haven't heard anything to the contrary, that it will be able to be lifted. The stay-at-home order will be lifted on the 26th, hopefully. After that, there will be kind of it'll be like a restoration of all of those things will happen in a stepwise fashion. So you can definitely expect, I know, because my kids ask me every single day, when am I going to hang out with my friends? And I say, well, here, my best guess is that, after we have that stay-at-home order lifted, there'll still be recommendations limiting social contact. We'll still won't want gatherings of, larger than 10 people. The critical infrastructure workers, the non-essential workers, getting people back to their jobs, that's going to be priority number one. In terms of looking ahead, my guess is that we'll be able to, hopefully, again, this is all if we continue doing a good job. If we have a massive influx of cases in Rio Blanco County, it might be different. We're hoping that won't be the case. So as long as we're still vigilant, we can slowly just get back to that normal life and be able to function.
Mm-hmm.
Very last then would be, just like when we started this thing, there'll still be a recommendation for a long time that people continue to socially distance and hand hygiene. Those types of things are not going to go away anytime soon. But in order to look forward to the near future, I do think we'll see life getting back on the rails. And we will guide you through that every step of the way. So we'll put out education explaining what's been lifted, what you still have to do, what you still can't do. It'll be easier that way than it will when we went into it. It all happened so fast, and it just caught us all by surprise for sure. It was a good move so that we were able to, really take control. But I think it'll be a lot clearer when we come out of it than when we all just jumped right into it. So.
Okay. And along those same lines, and this is from a salon owner, how long will we go back? How long until they can do hair again? How long until, temps, are masks? Is there going to be, because that's very hands-on, that's very personal.
Oh my gosh, yes. And, I'm asking that question for myself personally too, believe me. I think again, it's all about priorities. So the biggest priorities are going to be, critical workers, getting, businesses back on the line. That, like, I think with restaurants, obviously that's one where, they're still open because they're serving people food. So I think that'll be a big priority because we want to get that industry back and going. Mm-hmm. I do think that with the hair and nails and a lot of those things that involve the person to person contact, I think we'll see those recommendations get lifted, but they'll still just be recommendations. Very possibly the recommendation that those masks need to be worn and additional precautions need to be taken for quite some time. Mm-hmm. And so I mean, it's in some ways it's good news and bad news. But the good news is it's working. So I think that's really, really key to remember.
Okay. We've got a couple more questions that have come in from Facebook, but I wanted to, we had our last prepared question was about face masks. And I went to the post office. I saw one person. I had somebody call and say, there's one person in the post office with a mask on, and the other 9 people that were in there standing next to each other weren't wearing one. So who needs to be wearing a mask and when?
So the face mask recommendation is currently for everyone when going into public spaces or anywhere that you might walk past a vulnerable individual. Sneeze without knowing you have it and then unintentionally pass it on, because we know in a large part this came from the knowledge that I think the number they're throwing out there now is it could be potentially as high as 80% of the cases could have, no symptoms or mild symptoms. So, I mean, these numbers are just terrifying currently. if you're committed to social distancing and hand hygiene, it's truly not as important. I can't stress that enough. I mean, for example, with kids wearing masks, if someone asked me, are kids supposed to wear masks? And the recommendation is that kids wear masks also. However, the big problem, of course, is the proper use of it. So if you have a young child, ideally you don't take them to the grocery store because, they're going to be touching the mask and trying to get it adjusted on their face, and then they're going to touch the counter. And so you've completely defeated the purpose. So I think the CDC's recommendation clearly says everyone wear cloth face. The recommendation, it's voluntary that everyone wear cloth face coverings in public settings where other social distancing measures are difficult to maintain. Especially in areas where you have a lot of community-based transmission. So the funny thing about this is this could change. If we happen to get an outbreak here, you could hear me saying next month, this is even more important now than ever that you wear a face mask because we've got the stay-at-home order lifted. We're getting back into normal life. But oh my goodness, we have, 20 new cases here and we want to make sure we keep it under control. So wear your face mask, be extra vigilant with hand hygiene. So I think it'll constantly change. Thinking about the scenario, if you try to go places when there's not as much traffic, if you go to the post office, you're going during hours when you're not going to be in line, you're just going to check your post office box, not talk to anybody and come out. We all know that's almost impossible in Meeker, probably in Rangeley too. But, so having that discussion in like limiting your visits, making a point to avoid people during those trips is huge there for people who are just adamantly don't want to wear them. Some of those people, they come from a good place and the mask isn't perfect and it's definitely not protecting them. So it's about social responsibility. And at this point, definitely we recommend everyone's wearing them when they're in those public spaces. So
okay, good to know. And then we've got a couple questions. This person's diabetic, but it's well controlled for several years. Does that still put them in that higher risk category?
They're still saying diabetes in particular, and I think that has something to do with the immune response. There's so many more studies coming out. They're finding new things every day. They're finding, certain types of people with other things that you wouldn't even count as a chronic condition are potentially playing a role. They're looking at the genotyping and understanding, are some people more susceptible than others? Why do kids seem to be not as susceptible? So there's just a lot of different things that we're finding that's coming out. So for now, I would say yes, because we're not 100% sure how this thing works. And so even though it's well controlled, your diabetes can still definitely take a toll on your immune system as it's tied in to your immune response and could be. So
okay, and then this question, is 2 weeks long enough, or will that restart the cycle? And I think you kind of addressed that already by saying that we'll be restarting or re-entering normalcy step by step. And then I would assume watching for any kind of spike or increase to determine if that's going to cause a problem and then need to pull back.
Yeah. And it's a really fine balancing act, because now that we've flattened the curve, we're looking at mid-June for a peak in Colorado, which a peak again is where 50% of your cases come after that point. So it's not exact science, but what they're looking at and having flattened it a little bit, we're still going to have cases. There's still going to be hot spots within the state, and that could very well be here. Mm-hmm. So we have to think of it, and the answer is 2 weeks enough? I mean, probably not, but we also have to balance that with people's lives, and people have to get back to life. So how you do it is again going to be so important that everybody doesn't go, woohoo, it's over, we can get back to our life. We only had one case here. We all had it in January, so I think we're all immune and everything's fine. And then I think it could really nip us in the butt big time. So I think it's just going to be being careful and, following the orders as seriously as we can as they come out, and then slowly get back to life. So.
Okay. Can you see the chat?
I can't really. I'm just seeing the names. I don't see the actual questions.
Mental health issues as far as what the county is providing or offering, or what's available?
That's a great question. So Mind Springs does have a COVID hotline, and it was in our flyer that just went out. I believe we posted that on Facebook. We can repost, but we also do have a new resource tool we put together that's specific for mental health. So we've tried to include not just uh, the hotline numbers, but like, is Alcoholics Anonymous still happening? Who can you call if you need help with substance abuse? So we're putting together another resource that's specific to mental health, and that should be done pretty soon. And we'll be circulating that and posting that also, because that's a really good question. We did put in for a grant for some money to get some iPads purchased so we can help people with telehealth accessibility. That's something we've actually wanted to do for a long time. It's been on our list for increasing the access to care for mental health services, and that's a public health initiative for one of our 5-year goals. So that's another thing that could be coming down the line. There's a lot more telehealth options coming available, so we're hoping that that can be a way to connect some people. So we'll be focusing, of course, on those things in the coming months as well, and getting that all out to you. It's a great question.
Okay, and then we're going to do a couple more questions, and then I think our Zoom meeting officially comes to a close. So that I'm looking at these, trying to see.
Oh, lots of questions. That's awesome.
It's good. If in the next week science reveals that herd immunity is a viable strategy with measured reintegration and reopening, and the hospitalization rate is low, would the county issue relaxed guidance that may be in contradiction to the governor's stay-at-home order?
No.
Okay.
No.
That was easy.
Well, it's not going to happen just based on what herd immunity actually is. Now, the question as to if we don't have cases, a lot of cases and hospitalizations, we've done our job. We've done our job right by adhering to these orders as they've come out. And so the answer to that is no, because I'm not willing to take the chance.
Okay. Is the state science the only science that dictates county health policy?
Like CPHE? Absolutely not. No. We get our information from a variety of sources. So you've seen me, and if you watch my Friday updates, I reference lots of different websites. So like Johns Hopkins, for example, is leading the world on a lot of research. So we do our own research. We have epidemiologists at the state. It's funny, I'll pick up the phone and call them, and they're like, gosh, Alice, that's a good question. I have no idea. Let me know if you find an answer to that. So everybody's learning. This is all about doing evidence-based research. Like, that's exactly what the name of the game is on this one. So we pull information. Actually, I probably get more information from non-state resources than I do from state resources. They're an excellent support structure. But the science and the information we have is coming from lots of different places, internationally, nationally, and then a variety of sources. So that's a great question, though, I think.
Yeah. And then the last question is, why can they continue to work on construction of the school? And I think from what I've heard in meetings, construction is considered an essential service. They are practicing social distancing and following all of the rules and guidelines, and they are also gauging whether they can do that safely and whether they can continue to work safely, and that's why they're still open, because they're considered an essential service.
Yes, and a little bit further though on that one. So it's not just any construction. So we are deterring anyone from doing like residential or community. If you look at the orders, and there's a lot of information on the CDPHE website, but schools and hospitals are counted as community infrastructure. So it's not just the construction piece. We still as a county could say, we don't think you should be doing that. It's not worth it to our community for that to continue. So like in Routt County, for example, they stopped a lot of the second homeowners from doing repairs on their homes and those types of construction activities. So it's the construction isn't a catch-all, but the fact that it's a school and a hospital is kind of and the fact that they're adhering to these orders pretty closely. They're doing a vigorous screening process. We've been working with them from day one, so that makes us feel a little more confident. We also understand the impact to our community if we were to halt those operations would be pretty severe. So again, it's all a fine balancing act, but we also have reached out to them this week to discuss. We would like to make sure that those construction workers are respecting our county citizens and adhering to all of those recommendations off-site as well as on-site. So we've been working on that as well, in addition to what we've been doing with the companies themselves.
Okay, thank you. And then last one, I promise.
Okay.
Are these counts including people who have recovered or just active cases? So if we're looking at a number for the state for X number of people are confirmed, does that include people who've recovered as well as people who are actively ill?
It does. It does. It includes anyone who has tested positive. It also includes anyone who's epi-linked. So that means if and we actually haven't had many, we've had one here. If someone has a known positive and they have symptoms, but they don't necessarily need to go to the doctor, they're doing well, or maybe they had symptoms at a time when that person who tested positive had symptoms, they can confirm that as a case. There's a variety of different factors you have to have a confirmed case that's not got a laboratory confirmed diagnosis.
Okay.
So they're tracking. So those numbers include all of those as well, actually. And on the CDPHE website where they do explain that in the header. So if you read that, it does explain it a little better on what those numbers actually stand for. But the guess is that there's a lot more cases, obviously, than that. Potentially triple. I've seen a few numbers thrown out there. So again, why we're, driving home the importance of these orders, and that you never know, the cases in Garfield and Route continue to rise. So, we're highly aware of that and want to make sure we catch, it's not just about the tests. We want to make sure we catch any potential cases and report those to you all in a way that makes sense.
Right. All right. Well, thank you. And we will share those links again on our website and on our Facebook page. And if people have questions, they can either obviously get a hold of you, or they can get a hold of us, and we will pass those along, and we'll continue doing this. So.
Absolutely. I'd love to. And anyone can email questions anytime if they need a quick answer. They don't have to wait. I'm happy to, if you forward it to me, I can reach out as well.
Okay. Thank you again. Thank you so much.
Thank you guys. I really appreciate it.
All right. You have a good night.
All right. You too. Bye-bye.